Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Cross River State takes vaccination to refugees and displaced population in Ogoja local government area. Again, Edo government appeals to unvaccinated residents to present themselves for vaccination, assures that there is enough to go round. And UN Secretary General reprimands world for inequitable distribution of COVID-19 vaccines, grades it an F in ethics. A new report released today by the United Nations Development Programme, UNDP, and the National Bureau of Statistics, NBS, has shown that at least 20% of the full-time workforce in Nigeria lost jobs during the COVID-19 pandemic in 2020. Tagged The Impact of COVID-19 on Business Enterprises in Nigeria, it is based on in-depth interviews with almost 3,000 businesses from both formal and informal sectors across major industries of the economy. The report assesses the impact of COVID-19 on business enterprises in the country. It reads in part, from disruptions in supply chains to ongoing supply and demand shocks and a drop in consumer confidence, these challenges are expected to leave a lasting impact on the businesses and enterprises that make up the backbone of the economy. The report also highlighted the significant decline in revenue faced by enterprises and establishments across the country. Well, let's now take a look at the coronavirus situation update.
193 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 14 states and the FCT, indicating an increase from the figures reported earlier. FCT had the highest number of infections with 121 cases. 86 cases were recorded in Lagos. Edo had 70, Delta had 30, Rivers 24, Plateau 16, Benue 11, while 10 cases were recorded in Cross River. Abia recorded 8 cases. Bayelsa and Gombe states had 4 each. 3 cases were registered in Bauchi and Kano. Adamawa had 2, while Taraba had 1. There were 0 cases reported from Nasarawa, Ondo, Osun, Sokoto, and a backlog of 1 case from Taraba State. The overall count of confirmed cases in Nigeria now stands at 202,191. 338 people have been discharged in the last 24 hours, increasing the total number of recoveries to 190,901. 6 additional deaths from COVID-19 complications were reported in the last 24 hours, raising the fatality toll to 2,661. Presently, there are more than 8,000 active cases in Nigeria, while over 2.9 million samples have been tested so far. Over 4.4 million eligible Nigerians targeted for COVID-19 vaccination have been reached with the first dose, while over 1.7 million persons have been fully vaccinated. In Africa, there are more than 8 million confirmed cases and over 206,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 229 million, while deaths are now more than 4.7 million.
The federal government says it will prosecute people who engage in COVID-19 vaccination card racketeering as it enlists the support of the Department of State Services and the anti-graft agencies to track down offenders. The executive director of the National Primary Healthcare Development Agency stated this at the bi-weekly briefing in Abuja. Dr. Faizo Schreib also clarifies that Nigeria is not among countries on the United Kingdom's COVID-19 red alert list and their recently modified guidelines for inbound passengers.
The DSS and the ICPC are involved. Once these individuals who are involved in this vaccination racketeering are charged to court, then of course the public service rules will now follow, and that could lead to potential suspension and firing of these health workers. But beyond the health workers, those individuals who are also promoting or trying to access cards illegally will also be prosecuted. So it's a question of those who want to sell and those who want to buy will jointly be prosecuted. And we are taking this very, very seriously because of a minority, a few people, these types of activities can bring to disrepute the integrity of the whole vaccination process in Nigeria. So please, it's not just a responsibility for the Presidential Steering Committee, the Federal Ministry of Health and MPHCDA. It is the responsibility for every Nigerian. If you see something, say something.
And it's another appeal by the Edo State government for residents to safeguard themselves from COVID-19 by taking the vaccine. Speaking during the daily COVID-19 briefing at the Government House in Benin City, the Permanent Secretary of the State's Ministry of Health says there is plenty of vaccines in stock. The latest statistics from Edo State confirms that there are currently 672 active cases and 252 deaths recorded, representing 4% of the total confirmed cases. So far, over 116,000 persons in the state have received at least one dose of COVID-19 vaccine, and for the state government, the figures will continue to rise as it rolls out the second dose of Moderna vaccines.
As of today, we are starting the second administration of the second dose of the Moderna vaccine within the state. So those who had their first shot, starting from today, will start having their second shot to reduce, to make them fully immunized or vaccinated rather, and also to increase their immunity within the state. So far, we have vaccinated well over 116,000 cases, and we are still counting. And the vaccines uptake has improved significantly amongst our people. For those who have fears, they should try and relax and seek those who have not, who have been vaccinated, who can also confirm to them that the vaccine is safe beyond what they hear from us, the medical team. We are appealing to everyone to take ownership, and we have the right to stay alive. And the state government is also making everything possible to ensure that we attain or achieve that right of staying alive in the face of COVID-19 pandemic.
And staying in that region, ensuring that residents in Cross River are free from the COVID-19 pandemic, the state government has taken the vaccination and sensitization to the camp of the internally displaced persons seeking refuge in the state. Speaking in Ogoja, the local government area of the state, the Commissioner for Health, Dr. Betta Edu, explains that the health of everyone residing in the state is important, and the only way of achieving a good health coverage is for all to ensure that the refugees take part in the COVID-19 vaccination exercise.
As Nigeria continues with the second phase of its vaccination exercise, equitable access to safe and effective vaccines remains critical to tackling the COVID-19 pandemic. However, beyond the risks associated with healthcare services, education, sanitation facilities, refugees and displaced population may now have to confront additional barriers, including access to vaccines. Adagom Refugee Camp in Ogoja local government area of Cross River State houses many displaced persons, majority of whom are women and children, mostly Cameroonians seeking refuge. The Cross River State government is embarking on a sensitization campaign to educate the refugees on the need to get vaccinated, assuring them of the safety of the COVID-19 vaccines.
We've been able to immunize some of them, and we're still sensitizing them as we started the second phase of the COVID-19 vaccines rollout, that they should take their vaccines and continue to do all they're supposed to do to protect themselves against COVID.
Some of the refugees are happy to be a part of the vaccination exercise.
I hope the vaccine is fine for us to take, so that we should not get COVID-19, even though we don't have that issue here in this camp.
Ensuring vaccination against COVID-19 for refugee and displaced populations are vital for an effective pandemic response.
Well, joining us for more on the vaccination efforts in Cross River, Dr. Uche David is the Senior Special Assistant to the Cross River State Governor on Health, and he joins us now via Zoom. Thank you for joining us on the program. From the reports we've just seen, vaccination is taking place at refugee camps, but are there enough vaccines to go around?
Yeah, thank you so much, and good evening, viewers. The journey to the refugee camp has been one of the many advocacy visits that the Cross River State Public Health Team has been doing and conducting, specifically to those far displaced environments, including the refugee camps. We are still pushing on because of the level of hesitancy that appears to be far outweighing our overall, general population. For instance, as you can see in the clips that you showed earlier on, you need to speak to people who should be very responsible for the health and well-being of their family and other members in the camp, and you need to go with materials and other incentives to encourage them to take. So far, out of the 40,000 refugees that we have in these two camps in Ogoja there, a very few number, less than 1,000 or just around 1,000 have taken the vaccine so far. But we're not giving up. We are continuing our advocacy and sensitization, and we're engaging the WHO and the UNHCR management there to help us in pushing the vaccine penetration in the camps and indeed the communities around them. Generally speaking, beyond those challenges, our people have accepted vaccine more appreciably than we even thought in the overall population of the 18 local governments in Cross River State.
Dr. David, vaccine hesitancy is one thing. There's also migration and infectious diseases which are connected to travel. What steps are you taking to ensure that, the compliance to the safety protocols are still maintained, especially in the camps?
Yeah, these camps are administered at various levels. We do oversight once in a while there in our various advocacy camps, activities in the camps. We've gone ahead every time to meet with the administration of the administrators of the camp to ensure the various safety measures are maintained. But as you can see from the clips, it's a very crowded population, and they have their own autonomous government, so to say. So you need to go through the hierarchy of the various layers of administration they have there. We can only leverage on advocacy and the power to appeal to their sense of reasoning. It's challenging to control the crowd, especially in occasions where they need to gather together for one activity or the other. We are aware of even the polio and other infectious diseases threatening the population currently. We are hoping that when the WHO and other partners to the state join in our next phases of advocacy, we'll address all of this, including the security of the people who are there and indeed the preparedness for even the outbreaks that we may not yet understand, because this third wave has given us a lot of concern across the state in general, where many people who didn't take vaccination are among the majority of those who are falling ill now. And indeed, the mortality also shows that it's those who were not vaccinated who are currently falling to the deadly virus in this third wave. So, yes, that camp is our next phase of activity to concentrate on the issues of compliance with public health safeties in general and COVID-19 safety precautions in particular.
All right. Dr. Uche David, we appreciate your time on the program. Thank you so much for joining us, Senior Special Assistant to the Cross River State Government on Health. Thank you once again.
Thank you and welcome.
Still to come on the program, the Director General of the World Trade Organization mobilizes efforts to produce COVID-19 vaccines in Nigeria. Join us again. Welcome back. The Director General of the World Trade Organization, WTO, Dr. Ngozi Okonjo-Iweala, is mobilizing efforts to produce COVID-19 vaccines in Nigeria. Speaking to correspondents after meeting with President Muhammadu Buhari in New York, Dr. Okonjo-Iweala explains that she requested the President's support for some ongoing initiatives of the World Body. The former Minister for Finance and Coordinating Minister of the Economy laments the inequities in COVID vaccine distribution, saying that even the vaccinated are unsafe, where most of the population is unvaccinated.
The fact that on the African continent, less than 4% of us have been vaccinated, whereas in the rich countries, close to 58% have been vaccinated, is not something that really is good for the world. Why? Because we have all these variants that are circulating. And if you don't vaccinate people, they'll just migrate from unvaccinated to the vaccinated. So what we're saying is, in order to solve this problem, we have to produce more vaccines, and then we have to distribute them equitably to parts of the world that don't have. And that's the narrative. At the WTO, what we're doing is actually working directly with the manufacturers. We're helping them monitor their supply chains, which are very complicated. How can we facilitate this for them? In return, we're asking them to deconcentrate production and go to those parts of the world where they have and invest. For example, on the African continent, we don't want to continue importing 99% of vaccines that we use or 90% of our pharmaceuticals, so they should invest. And I think it's working. Pfizer announced a $100 million investment in South Africa recently. We're also looking at Nigeria, we're the largest country, and His Excellency, Mr. President, also wants to develop manufacturing. So we want to support that. We've been working with the Honorable Minister of Health to see what we can attract, the investment we can attract to Nigeria.
And since 17th May, international travel for leisure or holidays has been allowed in England. Initially, countries were given a red, amber or green rating with different rules for testing and quarantining on return. But from the 4th of October 2021, only the red list will remain. So what exactly does this mean? Our London correspondent, Juliana Lainka, joins us now to make sense of it. Hi, Juliana. What are the new rules for international travel?
Good evening, Millicent. Well, I suppose that the big one, the main story, has been yesterday's announcement by President Joe Biden that finally, after 18 months, restrictions that had been in place, crippling restrictions that had stopped people from the UK travelling to America, are going to be scrapped. They're going to be scrapped from November. Of course, you've got to be fully vaccinated, but for the airline industry, which has, been embattled for the past couple of months, this has come at a long-awaited relief. Just a couple of days ago, Heathrow is now being ranked the 10th busiest airport in Europe. And obviously, this is a massive downgrade for them. They've heavily relied on that very, very lucrative route to JFK, New York. So they are breathing a huge sigh of relief. And as I was discussing on the business shows earlier today, we've seen a surge in the amount of people that are looking for flights for Christmas and are actually even booking flights. I think Virgin Atlantic showed an increase of 91%. So that's that. Aside from that, yes, the kind of confusing travel list, which has been red, amber and green, has been scrapped. Not yet. It will be scrapped. I think you said the 5th, but it's Monday the 4th. Monday the 4th of October, there is basically going to be a go or no-go list for the UK. So no more green and amber destinations. Again, if you are fully vaccinated and you are coming from a fly list country, you can come into the UK. You don't have to rely on a pretty costly PCR test for departure. When you're in the country, you can use a lateral flow test. But yeah, there have been major changes. Some of them, Millicent, I've got to say, are still very confusing. So, passengers must make sure they check with the airline before they think of coming to England or anywhere else within the United Kingdom.
And a few confusing ones are, I mean, even now, when you look at the UK government's website, there are several countries that have been removed from the red list. Countries like Egypt, Kenya, Sri Lanka, Turkey, leaving about 54 countries still on that list. So the question really is, to what end if we have this deadline, October 4th, where we just have the red list?
Absolutely. You know, to what end is a good question, and especially for countries, you know, like Brazil and South Africa that have basically been on there since day one. It is really harmful, especially if you've got family that you haven't been able to see for several months. But I think, you know, a lot of people may have forgotten, because of the success of the vaccination program here in the UK, that Britain still has one of the highest COVID-19 death rates in the world, which is pretty staggering considering we are quite a small island nation. I believe the death count currently stands at about 135,000. It's still rising. If you think back, Millicent, to early last year, remember as well, Britain was very, very late in closing up its borders, and that has come at this high death cost. So I think ministers, the Transport Minister Grant Shapps, the Home Secretary Priti Patel, as well as, of course, the British Prime Minister Boris Johnson, are being very, very careful indeed to ensure that new variants, a higher transmission is not crossing into the border. And if they see a country has very, very poor vaccination rates or very, very high COVID infections, they are just not going to take the risk, which is why there are some countries that unfortunately are still lingering on that red list.
And finally, Juliana, home isolation for the unvaccinated has been termed weak as well. Some people don't stay home and they move around. Do you think that there are any other potential challenges with this list?
You know, there have been some scary headlines showing that people are not isolating, people are not following the rules. I think the government have tried to make it clear that you'll be fined. I think in some circumstances you could even face imprisonment if you don't keep up to these self-isolation measures. But it's pretty difficult when you've got, even with scaled down numbers, millions of people travelling into the UK every single week. You know, the borders are tight. The police are struggling to keep up with having to track people. How many people can you phone? People are not following the rules, which is why I believe the Transport Minister is hoping that at least once these rules are relaxed and the world does start opening up again, then perhaps, you know, they can use the police time into something that the police would rather do.
Well, Juliana, enjoy your evening.
Thank you, Millicent.
And the 76th session of the General Assembly begins today at the United Nations headquarters in New York. Given the opening address, Secretary General Antonio Guterres reprimanded the world for the inequitable distribution of COVID-19 vaccines, describing it as an obscenity, scoring the world an F in ethics. Out of 5.7 billion doses of the vaccines administered around the world, only 2% have been in Africa. Here's more on the Global Update.
Global Update begins in Australia, where hundreds of citizens have demonstrated in lockdown Melbourne after authorities shut down construction sites in the city for 2 weeks, saying the frequent movement of workers was spreading the coronavirus into regional areas. The demonstrators moved through the city centre, throwing bottles, lightning flares and attacking police cars as they chant slogans against COVID-19 vaccines and lockdown measures. Melbourne has been under lockdown for 7 weeks as the city struggles to control the spread of the highly infectious Delta variant. Vietnam has relaxed some coronavirus restrictions in Hanoi after 2 months of lockdown. Under the new order, government offices, markets and essential services such as banking and takeaway restaurants are allowed to open. Schools remain closed and public events and gatherings of over 10 people are still banned. Public transport remains suspended. And finally, bookings for coronavirus vaccines have jumped in Italy after the government made inoculation mandatory for all workers. The new rules in the workplace are some of the strictest anti-coronavirus measures adopted in the world. According to provisional data, the number of people making appointments more than doubled at the end of last week in the northeastern region of Veneto, while in Tuscany, they almost tripled.
It is crucial to limit the risk of COVID-19 infection among all ages. Take responsibility and don't disregard the good hand and respiratory hygiene practices. You can visit our website for more updates, breaking news, and more on the pandemic. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.